Hey everybody, and welcome to Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And for today's show, I am excited to be joined by my guest, Dr. Jeanine Bulan. Nice to see you.
Nice to see you. Thank you for having me.
Oh, it's my pleasure. Doctor, you are the Associate Chief Medical Officer for Atlantic Medical Group, and you have a particular focus on primary care and population health. Did I get that correct?
That is correct.
Great. And that is going to be particularly important because the title of today's episode is, do you really need to see your doctor every year? And look, I guess if we had to give it a one-word answer, the answer would be yeah.
Yes, you do.
Yes, exactly. You do. So, folks, Dr. Bulan and I are going to chat for a little bit, but this is, of course, kind of a three-person conversation. You guys have an opportunity to join us in this discussion as well. So if you hear something that you want to share your thoughts on, or maybe you want a little more clarification around, you can put a comment into the comment section there, and those will be shared with us. We'll try to get to as many of those as we can in our time allotted. Please keep them on topic, though. We have a specific purpose why we're here today. Anything we can't get to, we'll try to get to later on. If you miss any portion of this show, all of our community conversations can be found by subscribing to our YouTube channel. And you can also go to our website, atlantichealth.org, where they all live there as well. All right, doctor, let's get into it. So, we started this concept of, do you really need to see your doctor every year? And we don't mean like all these specialists. We're talking specifically about preventive care, right? And your primary care physician. What is preventive care? Why is that important?
So it's a great question. Preventive care is very important, especially in primary care. It's a time to be proactive about your health, to be proactive in identifying issues that you need to address for your personal health needs. And it's also a time to discuss important health screenings, vaccinations, answer questions, and get education about things pertaining to your personal health.
We talk a lot about forging, relationships with doctors. It would seem like that doctor is one you'd want to have a really strong, consistent relationship. How important is the doctor knowing you and you knowing your doctor to that whole thing working out the way we hope it does?
Yeah, I think most of us do feel that having a relationship with your doctor, with your primary care doctor, is very important. It allows for good continuity of care for yourself. It allows a time to develop the right care plan for you, and like we said earlier, discuss important screenings. So I think most of us do feel you want to have that right primary care clinician or the primary care team that is your place to go if you get sick, or even when you don't get sick and you need to check in.
They know you best. Knowledge is power, right, when it comes to your health care, and one of the topics that consistently seems to come up on this show when we talk to all kinds of physicians and different specialists is knowing your family history a little bit, sort of a blueprint to what you can expect. Tell us a little bit about why that's important and how that comes into play in this type of dynamic as well.
So family history is an important part of anyone's medical health history. So when you go to see the doctor, they will ask you questions about your personal health history, any medical conditions you have, any surgeries, but they're going to dive deep into what is your family history. Family history gives you a picture of your past that helps predict what we need to know for the future. So we do need to know conditions that your first-degree relatives have, your parents, your grandparents, your siblings, and then any other family history that you might think is important or you want to share will help give us a perspective. Do we also think that's important? So family history is a key checklist that we have to go through to determine, are there anything additional as far as screenings or vaccinations or care interventions to do from the clinician standpoint.
So we love questions here in the medical world. They're a favorite of ours. You may have noticed, folks, as you're watching, a link in the comments section already there, or if it's not there already, it will be there shortly, to a survey tool that we have for patients to take to, I guess, really it's for anybody interested in getting a better sense of what your preventive care needs might be. Can you talk a little bit about why you might encourage folks to take that and kind of why we're asking folks to do that?
So I think having a preventative checklist is key, and it helps guide us based on your age, your health history, your risk factors, and then it will come up with just a basic guideline for you to then bring to your primary care clinician and discuss, are all of these things I need to do? What do you think I need to do first? And how do we prioritize the care plan that this tool can help just bring to your attention? So it's a great first step if you have a primary care clinician and you want to do the tool and bring it in for a great topic of conversation, or if you don't have a primary care clinician but you need to identify what screenings you should be doing, the Preventive tool is a great help.
And I know dozens of folks have already taken it and really are finding great usefulness there. So I would encourage anybody who hasn't had a chance to do it yet, please do so. And then let us know what you think. We talked a little bit about some of the screenings and examinations that can be of such value here. On an annual type basis, what are the types of screenings and exams you think folks might need to have or go through?
So for adults, if you check in once a year, that's usually a good time for screening and preventative care. Your clinician may ask you to come more frequently based on your personal health history, and some medical conditions require more frequent check-ins and visits with the clinician. But for an annual preventative visit, usually you will find reviewing the history is the first thing that we do. We, again, review history we know, or we learn about history we don't know, which we need to know about. We would review any changes over the past year that we want to now discuss in depth. And then we go into checking vital signs, which is usually the first part of the physical, and then whatever physical exam would be pertinent. So usually those will be the initial starts of the visit, and then the visit will end with answering whatever questions you might have, discussing the preventive screenings that we feel are important for your age and health history, and then review vaccinations or other educational materials that are pertinent.
So we solicited a couple questions ahead of time before the show. One of the ones that I think is most relevant that I just want to touch on was, how do I get a primary care physician? Now, I'll let folks know, if you go to our website, atlantichealth.org, along the top, there's a couple buttons along the top, but one of the things you'll see there is the Find a Doctor link. And what you can do is click on that, and then you'll get a whole list of physicians, folks who are part of our system of care, who and some of them are specialists. So if you're looking for somebody who specializes in one particular area, you can sort them that way. You could do it by geography, language spoken, all that stuff. And then of course one of them is primary care, and so you'll be able to identify folks so that if you don't have that relationship, you can start to cultivate one. And so again, the Find a Doctor link on our website is a great place to start. Is blood work part of the annual surveys we always would encourage people to do as part of their physicals?
So that question comes up a lot, and I think you might get out on the internet and read and say, do I need this? Do I not need this?
That can be a dangerous thing to do.
That can be dangerous. It can be helpful, and it can also raise a lot more questions. So blood work can be part of the annual wellness for adults, and again, it really depends on your personal health history and health risk. And so it's a conversation you want to have with your clinician. What should you have? Commonly, we do check basic cholesterol levels and some basic tests that help give us an overall picture of what's going on.
You know, I know a lot of younger folks who have kind of just said, I feel fine, I don't need to go to the doctor, forget it. We don't want those younger folks to think they're invincible too, right? Is it important for all ages of folks to participate in this kind of examination and screening?
I think it is important, and I think it's good to start younger to develop that relationship with your clinical team. Right. So no matter what your age is, and really even if you have a very healthy medical history and healthy family history, there are still preventative care and preventative vaccinations that we should be discussing. So yes, we do promote that. You
touched on something that I want to circle back to because I think it's important about making the best use of time when you're in with your physician. And we talked about, take take the survey tool we have to help you build that checklist. But for the folks who, even if they do go to that level of preparation, what's your recommendations for when you're in there making the best use of time with your physician so you come out with a real good sense of how you're doing?
I think you want to prepare for your visit just like you would prepare for an interview or prepare for a visit somewhere else. You want to look back and say, okay, has anything happened in the last year that I need to tell my clinician about? Is there a new development in my family history that I should be reporting? And then come up with questions that you have. What screening should I be doing? What vaccinations am I due for? Or I read something on the internet and I wonder, does this pertain to me? So going in prepared really makes the best use of your time. I think leaving also with the right materials is important. So all of our patients get an after visit summary that will outline what occurred at your visit. It will summarize your vital signs on there. It gives you a list of any recommendations your clinician made or specialists they want you to see. It's all on that after visit summary. And so that is a great take home. And whether the take home is in paper or it's virtual on your MyChart, it's something you want to access when you leave the visit.
Just want to touch on one additional thing you shared there, which is this notion of a visit to a primary care physician could result in a recommendation that you see another physician. Let's give folks a sense of what to expect and when those types of things might happen, and whether or not that's, and how we draw those connections. What would that give us a scenario where that might happen?
So during the visit, we are here to get information. So sometimes the information might come from something you share with your clinician. The information may come from taking a vital sign, and we see your blood pressure is all of a sudden elevated. So whatever we identify during the visit can lead to additional screenings or testing and things that we want to do to make sure we're taking good care of you. So if we identify something during the visit that requires follow-up with a specialist, then we can direct you to a member of our great clinical team and get you set up with the right people. But again, a lot of that is why preventative care is so important. We want to be proactive. You might not feel your blood pressure is elevated, but we will see it and know we need to do further testing and act on that.
You don't know unless you get in there and get examined.
Yep, you don't know unless you go.
So I want to make sure for those viewers of ours who came in a little bit late, we're talking about preventive care, which is a term that, if you're outside the medical world, may not be one that's intuitively known to you. So I want to hop back just for a moment on kind of where we started for those who might have joined late. This idea of preventive care, of seeking out medical care even if you don't think you necessarily need it. Can we talk, let's just kind of reboot there. Let's talk a little bit about why that's important and what preventive care is.
Mm-hmm. So again, preventive care is being proactive about your health. It's looking to see what health screenings you're due for. It's looking to identify, are you due for vaccinations? Are you due for cancer screening? Depending on your age and your risk factors, what cancer screenings are right for you at this time? So these are conversations you want to be having regularly with your clinical care team, with your primary care clinician, or even your specialist. But it's important to know what you need to do so you have a good plan of care throughout the year.
So we've got just another minute or two left. We created this program, the title of this program, around this concept of, do you really need to see your doctor every year? And for reasons that we've gone over throughout this entire show, the answer obviously is yes, for all the preventive care reasons we've talked about. And it harkens back to another point that I just want to reinforce for everyone, the need to build that long-term relationship with your physician. Again, Dr. Bulan, for folks who say, well, my friend's got a doctor and I guess I'll go see him or go see somebody else, or maybe I didn't like that one doctor, so I want to go see somebody else. How important is that dynamic, and what would you recommend folks look for when they try to build that relationship with that primary care team or that primary care physician?
I think it's good to have a relationship with a primary care physician or care team, and the great thing is now there's so many different clinicians that are part of our medical group and our health system. So you want to find someone that you can communicate with, that you resonate with, and sometimes that is through a referral through family members and friends using our Find a Doc webpage. But there is a primary care clinical team out there for you. And so now making sure you get out there and just find the right person. There are many fish in the sea, so to speak. There's many fish in the sea. But it is a matter of just finding the right home and the right fit for you. So the nice thing also about our medical group is we have an electronic medical record that helps us take care of you throughout your care team. So again, it just optimizes your relationship with your care team and allows for good integrative quality care.
So let's touch on that real quick too, so folks get a sense of why that's valuable. What is that sort of integrated record do for physicians when they're trying to assess what the overall health of this patient is?
Yeah, it keeps them updated and informed on important parts of your medical history. So what allergies do you have? What surgeries may you have had? And this way, you don't always have to repeat it every time you go to see the doctor or the clinician, but it's there so that they can take the right care for you.
And you can see it on your phone, too. It's pretty
convenient. On your phone, and it's on MyChart. So you have access to all of it, and it's also a good reminder system for you. If you know your mammogram, for example, is due, October is Breast Cancer Awareness Month, and you know it's time for your mammogram, it will be on your MyChart to help keep you on track with the screenings you need.
Dr. Bulan, we're out of time.
Thank you.
Covered a lot of ground, though.
We did.
I feel like we did.
We did.
Thank you so much for joining me today.
Thank you for having me.
All right, folks, if you missed any part of our conversation today, as I mentioned, please subscribe to our YouTube channel. You're not just going to see this awesome show with this awesome host. You're going to see all the great programming we put together here at Atlantic Health System. So subscribe there. And then if you want to check out any of the other community conversations we've done over the past few years, you can find all that on our website. Along with that Find a Doc link we talked about earlier, go to atlantichealth.org for that. All right, folks, thanks so much for joining us, and we'll see you next time on Community Conversations.